Welcome to Encompass Pregnancy Care Cranbrook. At Encompass, we believe in empowering patients through compassionate, personalized pregnancy education and care. Our core values center on respect, education, and proactive participation to ensure you feel confident and supported throughout your journey. Our community is beautifully diverse, and inclusion and non-judgmental care are central to our approach. We understand that pregnancy is a unique experience, and being informed and engaged makes all the difference. We want to provide you with the knowledge and encouragement you need for a healthy, positive pregnancy journey. We're here to walk alongside you every step of the way. You can be referred to Encompass by your family physician or self-refer if you don't have one. If you self-refer, our nurse will give you a quick call to discuss your pregnancy and arrange any necessary blood work and ultrasounds. After your referral, your journey with Encompass begins with a phone intake, around 10 weeks of pregnancy with a nurse, physician, or midwife. This first call helps us understand your needs and plan your care. We'll chat about early symptoms, prenatal vitamins, folic acid, and any urgent concerns. We'll also discuss the available genetic screening options so you can better understand your choice and preference and what to expect from our collaborative care team. Genetic screening is available to everyone. There are both funded and private pay options that depend on your age, when you start care, local resources, and personal preference. Timing is important. Visit Perinatal Services BC website for more information. If you experience urgent concerns before 20 weeks, like bleeding, pain, or severe nausea, contact your family physician, call 811, or present to the emergency room at East Kootenay Regional Hospital. Around 12 weeks, you'll have your first in-person visit. If your phone intake reveals any urgent needs, we'll see you sooner. Throughout your pregnancy, you'll meet our entire pregnancy care team of nurses, midwives, and physicians. So when the time comes to deliver your baby, you'll have a familiar face to support you in the delivery room. The first in-person appointment is the perfect time to bring your questions, like, is it safe to exercise? Or when will I get my genetic screening results? Writing them down ahead of time helps make the appointment productive. Your provider will review your initial lab results, answer questions, and confirm your official estimated due date. They'll also discuss your overall health, medications, lifestyle habits, and even how you might wish to feed your baby. 9 months may seem a long time away, but time will fly by. If you'd like to bring a partner or support person, they're always welcome. Routine results will always be reviewed at your next appointment, so please do not call the front desk for updates. If something is urgent, we'll call you. You'll also receive your first appointment information package. We may perform additional screenings such as PAP or STI testing right here in the clinic. We'll also discuss exposures, things like infections, pets, or work environments, and talk about your travel plans. Finally, we'll make sure you get any necessary referrals for services. As you move into your second trimester, our focus is on ensuring a strong foundation for your health and your baby's development. Each visit includes vital maternal checks like blood pressure and baby's heartbeat. If we find any high-risk concerns, we'll discuss specialist referrals to ensure you receive the best care. Around 20 weeks, we'll arrange key assessments including an ultrasound, screening for gestational diabetes, a complete blood count, and check iron levels. And if you're Rh negative, we'll arrange a blood type and screen. This is also when we start preparing for what's ahead. Topics we may cover include pelvic floor health, managing stress and ensuring good sleep, fetal movement awareness and counting, nutrition, exercise, prenatal classes. We can also connect you with services through the primary care network, a local team of health professionals including a mental wellness clinician, physiotherapist, dietitian, and social worker to support you throughout pregnancy and provide personalized care. After 20 weeks, if any concerns arise, you should go directly to the maternity unit at East Kootenay Regional Hospital for assessment. As you continue your journey, your mind may be full of questions like, my iron is low, what supplements and dose should I take? What is the gender of my baby? Or what's the safest sleep position? Remember, we are your best resource. Bring your questions to your next appointment, and we'll be ready to give you clear, evidence-based guidance. Welcome to your third trimester. As you near the final stretch, your appointments become more frequent, typically every 2 weeks, then weekly. These visits focus on final preparations and screenings. Here's what to expect during these visits: maternal and fetal checks, Tdap vaccine, flu vaccine, Group B strep test, membrane sweeps from 38 weeks. You may have particular ideas for your birth, about who's present, pain management, and what you would like to do if things don't go as planned. You can't really plan your birth, but there are things you can do and think about to prepare. Let's talk about it. We can discuss your preferences and questions, including available pain management. Can I have an epidural? Labor support? Who can join me in the delivery room? And any cultural traditions. Can I include ceremony or traditions during labor that are important to you and your family? East Kootenai Regional Hospital can facilitate smudge ceremony requests for patients and their families following interior health policy. Please talk to your provider as soon as possible to ensure we have the maximum amount of time to prepare for your request. As your labor and delivery dates approach, we'll also review signs of labor and when to come to the hospital, the difference between Braxton Hicks and true contractions, the chances of an operative delivery like a vacuum, forceps, or C-section, and the types of interventions that might be needed. This is about being prepared for any scenario. If you're unsure whether labor has started, call the maternity unit or come into the hospital for an assessment. During labor, our dedicated team will support your comfort, offering pain relief options based on your preference. After your baby is born, we'll support you with skin-to-skin contact, breastfeeding, and newborn care. One important step is a vitamin K injection, recommended worldwide to protect babies from rare but serious bleeding caused by naturally low vitamin K levels at birth. Encompass will see you for follow-up appointments at 1, 4, and 8 weeks after birth, with extra visits scheduled as needed. A public health nurse will call you soon after you get home to check in on both you and your baby. They offer home visits, free breastfeeding support, and are available by phone locally 5 days a week. They are a great community resource to support you as you settle in. The postpartum period is one of incredible change. As your body heals, here's what to keep in mind. Physical health. Your body has just done an amazing thing. Emotional recovery. Breastfeeding or feeding challenges. After 8 weeks, care transitions back to your family physician for ongoing follow-up. If you don't have one, please register on the Health Connect Registry, a free provincial service that helps connect patients with available primary care providers in their community. Don't forget to contact Public Health to book your baby's immunizations. After discharge from Encompass, it's recommended to see your primary care provider regularly for well baby checks to ensure your baby is growing and developing well. Most family physicians and nurse practitioners suggest well baby checks every 2 months for the first 6 months. If you do not have a primary care provider, public health nurses can also see you regularly for these checks. If any urgent concerns arise, or if you do not have a primary care provider, you can also access Cranbrook's Urgent and Primary Care Center. Local and provincial supports are available. We're excited to share this experience with you. Your role is to take care of your health and your baby's health. Our role is to provide safe, compassionate, evidence-based care for you and your growing family. We are your partners in this journey, ensuring you are prepared and supported from day one to delivery and those special first weeks.